It's lunchtime in this community centre in Caracas. A free meal for young mothers and their children, donated by a local charity. Of the 20 or so people here, we found 2 that had something in common. Both had been afflicted in the last fortnight by a mosquito-borne disease. 2-year-old José was recovering from a severe case of hemorrhagic dengue.
When we came back one day, he had blood coming from his ear and here. They sent me to a hospital where they said it wasn't dengue, it was a parasite.
It was dengue, and eventually José had to have a blood transfusion. He's fine now, but he is lucky. This mother, meanwhile, had just got over a bout of chikungunya, a debilitating virus.
I had fever, dizziness, I lost weight, and so did my child because I was breastfeeding.
Both said the situation was complicated by Venezuela's economic decline. José's mother said there'd been no anti-mosquito fumigation by the government here for 13 years. Stories like theirs are told millions of times over in this country, which is facing the most serious public health crisis in its history.
The problem in terms of scale will be huge in Venezuelan terms. We have almost last year close to 1.2, 1.5 million cases of malaria, close to 10,000 cases of diphtheria, and close to 9,000 of cases of measles.
The figures the doctor quotes are not official. That's because the government here has not released comprehensive data on diseases since 2006. Those on the front line in this fight are having to make some educated guesses. In the case of malaria, the disease itself carried some clues. Gene tests of infected patients in South America have shown that most infections originated in Venezuela. One reason for the marked rise is a surge in wildcat gold mining in the south of Venezuela. Hundreds of thousands of people now come to this area where malaria has long been prevalent to try to make a living. They then spread the disease to other parts of the country when they head home. For Dr. Maria Lopez, president of the Venezuela Society of Infectious Diseases, the malaria example just shows how this country is in the midst of a perfect storm, facilitating the spread of disease.
The health situation here is serious. We are in a complicated humanitarian emergency because this is about health, but it is also happening against the backdrop of a social and economic issue which is only making things worse.
One issue she cites is that of water. As part of a general deterioration of public services, at least half of Venezuela's hospitals and millions of homes are without reliable running water, a major public health challenge on its own. The economic collapse here has been a key factor behind the rise and re-emergence of several diseases, and it's left the government ill-equipped to tackle the problem. President Maduro argues that outside factors, especially recent US sanctions, only increase the hardship Venezuelans are facing. Washington says this is a crisis of his own making. Either way, this region is learning, once again, that Venezuela's problems are spreading beyond its borders. Stephen Gibbs, CGTN, Caracas.